Good morning, everyone. I see everybody starting to join. We will get started in a second. Just giving everybody some time to log on real quick. Thank you guys for joining us for day 2 of the Aim for Zero Suicide Symposium. Today, our focus will be on equity, cultural responsiveness, and suicide prevention in healthcare. If you missed any of the sessions from yesterday, they are recorded and they will be found in the auditorium under day 1. So if you're interested in checking any of those presentations out, definitely do so. All of the recordings for all of the sessions will be available on the platform for 30 days from the day they were posted. So feel free to check them out in the future as well. Just some reminders that we mentioned yesterday, but if you didn't join us yesterday, this is probably the first time you're hearing this. The chat will be open for questions. We will hold all of the questions until the end. The Q&A box is available as well. CEU credits, CME credits will be available as well. We will send the evaluation out at the end of the symposium at the end of this week. So stay tuned for that as well. And so we will start off today with Keygan Miller. Keygan is the Senior Advocacy Associate for the Trevor Project, the largest suicide prevention and crisis intervention organization for LGBTQ young people. Keygan is responsible for the research, advocacy, and legislative agenda for the Trevor Project in the area of school suicide prevention policy, as well as the day-to-day operations of the advocacy team. So today we will be hearing from Keygan on the topic of from equality to equity in LGBTQ youth suicide prevention. So thank you, Keygan, for joining us this morning.
Thank you so much. Go ahead and share my screen there. All right, good morning, everyone. As Kara said, my name is Keygan Miller. I use they and them pronouns, which we're going to talk about a little bit later. But I am the Senior Advocacy Associate at the Trevor Project, the world's largest suicide prevention crisis intervention organization for LGBTQ young people. Our mission is pretty simple, although it is not easy, and that is to end LGBTQ youth suicide. Trevor runs a variety of programs, including our 24/7 Lifeline chat and text, as well as robust programming via our research department, advocacy and education. And I would be remiss if I didn't mention our Trevor Space, which is a social networking space for LGBTQ young people. All of these lead to ending LGBTQ youth suicide in a variety of preventative and intervention ways. So I'm here to talk this morning a little bit about LGBTQ youth suicide. Now, most of us know that youth suicide in general is a problem. It's the second leading cause of death amongst young people ages 10 to 24. But for LGBTQ youth in particular, this is dire. 42% of LGBTQ youth seriously considered attempting suicide in the past year. That's 4 times more likely than their straight cisgender peers. The Trevor Project, in fact, estimates that 1.8 million LGBTQ youth seriously consider suicide each year. So again, this is dire needs. But why is there this disparity between our LGBTQ young people and their straight cisgender peers? Well, in order to look at that, we have to look at a few different aspects of LGBTQ young people's lives. So 75% of LGBTQ young people have reported that they've experienced discrimination based on sexual orientation or gender identity. So that's everything from being denied services to being told to use a certain bathroom. There's a variety of ways in which that discrimination happens. We also know that discrimination comes from adults in their lives, peers in their lives, outside authorities. Less than half of our LGBTQ students were out to an adult in their school. 2 in 3 LGBTQ youth reported that someone tried to convince them to change their sexual orientation or gender identity. Now, when we say that they've tried to convince them to change, that might be commenting that, oh, you can't be gay, you must, you have to be straight. It's that kind of thing. It could be a comment, or it could be something as terrible as conversion therapy, which is the idea that we can change someone's sexual orientation or gender identity through a variety of means, which is a discredited and dangerous practice. We know that 58% of our transgender non-binary youth reported being discouraged from using the bathroom that corresponds with their gender identity. So something like meeting one's basic needs of being able to use the restroom, 58% of our trans and non-binary young people had issues in that area. And then we get into the big bullies of the world of politics, and 76% of LGBTQ youth felt that the recent political climate has impacted their mental health or sense of self. So everything from something in your day-to-day life, such as using the bathroom, all the way up to the narratives that are being woven by people in the highest of power in this country. So what we have to consider is all of these issues are problematic in themselves, but what it does is it affects someone's crisis threshold. And here's what I mean by that. We have to look at baseline vulnerability. If someone has a lower baseline vulnerability, when a stressor is introduced, they're not as likely to meet that crisis threshold as someone who has a higher baseline vulnerability. When a stressor is introduced, they're likely to rise over that crisis threshold. And this is where we end up with a lot of suicidality. So here, if we think about our LGBTQ young people who are experiencing discrimination, bullying, and other negative responses in reaction to their identity, they're likely to have that higher baseline vulnerability. So when the average stressor for our young people, maybe it's not making the team, or a relationship ending, or losing someone that they love happens, that can cause that person to rise above that crisis threshold, when a peer with a lower baseline vulnerability would simply just be in a stressed state. This is particularly important for young people who hold multiple marginalized identities. At the Trevor Project, about 35% of the youth we serve are youth of color. Our 2020 research brief identifies that Black LGBTQ youth suffer similar rates of depression as all LGBTQ youth, but they're significantly less likely to receive personal care. So we always want to make sure that we're paying attention not only to our LGBTQ identities, but we're looking at those intersectional identities as well. Speaking of care, we also know that our LGBTQ young people want counseling and mental health, but are oftentimes unable to receive that care. In fact, 48% of our LGBTQ young people on our most recent survey reported wanting counseling from a mental health professional, but they were unable to receive that care. So what that might mean is maybe they don't have general access to mental health care. We know that mental health care access, of course, is a challenge for a lot of people. So that could be part of it. It could be that the stigma around mental health and not being able to seek out mental health care because of parents or guardians not allowing for that. It could also be that an LGBTQ young person wants to receive care, but because they're LGBTQ, they can't find supportive care, and so therefore can't get that help. But all of these things, all of this kind of disheartening news, isn't hopeless. Our LGBTQ young people are resilient, and there are so many things that we can do to help reduce some of these areas of issue. In fact, one of the simplest things we can do is, if you are an adult, is being a supportive adult of an LGBTQ young person, because we know that LGBTQ young people who have one supportive adult in their life have 40% lower risk of suicide. 40% by just having one supportive adult. Now imagine if a young person has multiple supporting adults in their life, how much impact that could have. So how do you become that one supportive adult? Well, there's a lot of things. First, educate yourself. You're starting to do that right now, which is great. And once you have educated yourself, help educate others about LGBTQ issues. This is everything from understanding pronouns to understanding identities. One of the things that our young people face in the mental health space is having to educate their mental health providers about their identity from a very baseline level. So if we have that baseline understanding, then we can really dive into what that identity means for that young person, as opposed to having a 101 level conversation. We can make sure that we're not assuming someone's identity based on their appearance, based on conjecture, any of those things. We can actually ask that identity and make sure that we're respecting that identity when we found it out. If you don't know, asking is the best way to do that. That includes asking someone's pronouns. It is completely and utterly respectful to say to someone, I want to be respectful. What pronouns do you use? We do use what pronouns do you use instead of what are your preferred pronouns. Preferred makes it sound like it's a preference, like chocolate or vanilla ice cream. And my pronouns aren't my preference. They're the pronouns that I use and the pronouns that validate my identity. And pronoun use, by the way, is also suicide prevention. Trans and non-binary youth who have their pronouns respected regularly attempted suicide at half the rate of those who didn't have their pronouns affirmed. Half the rate. So again, something as simple as educating yourself about someone's pronouns, asking in a respectful way, and utilizing those to the best of your ability is suicide prevention. Yeah, another thing we can do is address underlying causes, treat the whole person. One of the barriers to care that we often find is that young people are being treated for mental health conditions on the assumption that it's caused directly by their being LGBTQ. A lot of these risk factors are not about the young person identifying as LGBTQ. It's about the response that society has to their identity. So in that same vein, we want to make sure that when we're talking about mental health spaces, that if we're treating someone for depression or anxiety or a variety of other mental health issues, that we're not always assuming that those issues are caused by them being LGBTQ. Now, certainly they can be exacerbated by that, as noted, but we want to look at it. Sometimes people just have anxiety. Sometimes people just have depression. Sometimes people, it has nothing to do with their identity, but those symptoms might be exacerbated by societal's response to their identity. And then we want to look at factors that are raising that baseline vulnerability. We want to make sure that we're addressing issues of homelessness, of economic instability, of access to physical health care and mental health care, all of access to a supportive environment, all of those little things that build up that higher baseline vulnerability. We want to try to lower it as much as we can because we know our young people are going to have stress introduced into their lives. We know that there's going to be situations that causes that threshold to be breached. But if we can keep lowering it by removing some of those mitigating circumstances, we'll have a better chance of not reaching that crisis threshold. And then finally, the last thing you can do is advocate for supportive and inclusive policies and procedures. This is everything from ensuring that your local schools have suicide prevention and mental health, teaching their teachers how to look for signs of suicide, teaching their teachers how to be inclusive in their practices, making sure our young people are taught about mental health in schools, making sure that we have basic crisis services plans in place in our schools as well. It can also look like advocating for LGBTQ protections in work, housing, public accommodations. There is an outright attack on trans youth in this country currently, trying to prevent them from participating in sports or seeking out mental or medical care that supports any type of transition. So make sure that you're advocating on those issues. We can advocate to end the dangerous and discredited practice of conversion therapy, and making sure that our LGBTQ populations are noted and focused on whenever we're talking about mental health and suicide prevention, as well as other vulnerable populations that sit at the intersection of identities. In regards to educating yourself and educating others, there are a ton of resources available online. I would be remiss if I didn't talk today about some of our resources at Trevor, such as our Guide to Being an Ally to Transgender and Non-Binary Youth, our handbook, our coming out handbook for LGBTQ young people, and Approaching Intersectional Conversations. All of these resources are available and more on Trevor's website. You can go to trvr.org/resources, and it'll take you to a plethora of ways, again, that you can both support educating yourself and others, as well as some resources for our LGBTQ young people directly. We can end LGBTQ youth suicide. We can lower some of these baseline vulnerabilities that are making our young people reach crisis quicker. But we can only do that if we take the time to make sure that LGBTQ young people are at the forefront of a lot of these conversations going forward.
Right. Thank you so much, Keygan. So the question and answer area is open. If anyone has any questions, we do have one. Could you repeat the correct language for asking of pronouns?
Absolutely. The best way to ask that is to just simply say, what pronouns do you use? Again, the idea is that we're not using preferred in that sentence. So what pronouns do you use is appropriate. For a lot of people, they have, if you are doing intake forms as well, that's a really great time to find out someone's pronouns as well, just by simply putting the word pronoun on the form and leaving a blank. People can fill it in. Those are great ways to figure that out.
Any other questions? Coming in. Do you believe that discrimination is greater in Latino communities?
So that question is, it could go one of two ways. So I'm going to try to address both and see, and hopefully I hit it. If you're asking if it's greater for the Latino community that is also LGBTQ in general from society, yes, again, when we talk about those overlapping identities, that intersectionality between identities, definitely our Latino LGBTQ young people are experiencing higher levels of discrimination just based on having racial discrimination and sexual orientation or gender identity discrimination over top of each other. If you're asking, is the Latino community the cause of higher LGBTQ discrimination, that's really hard to say. There are different cultural differences between the Latino community and other communities in what is considered acceptable behaviors and identities and not. Sometimes that can be a source of strength, and sometimes it can be a cause of higher problems. So it can kind of go either way.
All right. Max says, I'm a social work intern at a high school with gendered bathrooms. How can I be a supportive adult in helping my non-binary students navigate this?
Yeah, so there's a couple of different things there. Unfortunately, if there's not a single stall gender neutral bathroom anywhere on campus, that can be a problem because you don't have that option. The biggest thing is making sure that the policies are in place that allow for that young person to make the choice daily as to what bathroom to use. So it's one of those situations where maybe today it's more comfortable to do one than the other based on the way that they're feeling or the way that they're dressed or the way, whatever, again, however they're feeling the most comfortable. But oftentimes our policies in schools say that they can use the bathroom of their choice, but what they're really saying is they can use the gendered bathroom that they choose consistently, right? So for our non-binary folks, having that option of being able to flip back and forth on what's most comfortable is your best choice when you don't have gender neutral bathrooms available.
All right. Larissa asks, how would you recommend managing parents who have not accepted their child's gender identity?
That's a great question. So again, context is key on this one. But I think really I try to educate without judgment. Like this is the thing that I always say, is that people come to this from a variety of different ways and backgrounds, whether it's a strongly held religious belief, whether it's just ignorance of the issue, or if it's just a not my child kind of thing. There's a variety of reasons that parents aren't accepting of their young people's identities. So really trying to understand where they're coming from first and why they hold those beliefs is the first important key to that. And then you can start to address some of those underlying issues. In the meantime, being the supportive adult in that young person's life, so that way they know that they have a place and a person to be fully themselves with, is the best way you can help make sure that that young person is taken care of while you work on parents. Unfortunately, some parents never quite come around to that, and that's the sad reality of it. So all we can do is keep educating and be there in support of our young people in the meantime.
Thank you. Jill asks, how can I support youth in schools who want to be referred to as a name other than the one in the school record, especially if it is a name of a different gender?
Call them that name. That's the simple answer, is call them that name. But to be a little bit more expansive on that, I always recommend asking our young people how they want you to go forward. Like, for example, in combining this with the question from before, if a young person isn't out to their parents, I'm a former teacher. So as a teacher, I would say, hey, I want to be respectful. I want to call you by the name you want to be called by. And I'm happy to do that in my classroom for sure. Would you like me to use that name with your peers, with other teachers, with your parents? And really just see where that young person is at. And then whatever that young person says, follow that. I've had a conversation with a parent who, the young person said that I want you to use it all the time. And I said, okay, great. And the parent said, well, that's not my child's name. And I'm like, well, we're in my classroom. And in my classroom, I respect my students' identities and I respect the requests that they make. And just like I would call a student whose name is Joseph Joe, if someone gives me another name to call them by, that's what I'm going to refer them to them as in my classroom. I can't control what happens outside of my room, but I can certainly keep in mind what happens inside, and I can create that safe space. So again, ask the student what, where, and how that they would like you to use that name, particularly if it's not officially changed on records, and then try to create that safe environment within your locus of control.
All right. I think this is more of a comment, but I think you could respond to it. Something that comes up a lot are requests from medical providers who are performing surgeries, i.e. top surgery, or to start hormones, to have the person's mental health provider attest to the person's mental health stability. Sometimes this feels unfair or unnecessary, that it has to be cleared, so to speak, when this is the person's identity.
Absolutely, I agree with you 100%. Unfortunately, right now, most of the country follows WPATH standards, which is the baseline care for trans people, and there are certain markers that have to be met along the way in order to get gender affirming surgeries. So it's a lot of red tape and hoop jumping for trans people especially for trans people who have been solidly in their identity for years. And just are now accessing the care that they need to align their bodies in that way. The best thing you can do if you're a mental health provider is just be as quickly helpful as you can. Obviously stay within professional standards, but there's no need to drag on something when someone's identity is clearly aligned with where they're going. Yes, fill out that paperwork, send that letter, do all those different things, and advocate that doesn't necessarily need to be the way it is.
And if there is something pertaining to LGBTQ that you don't know or unsure of, is it okay to directly ask the youth without offending them?
The best way to do that is to really say, you know, that word or that identity means a lot of things to different people. Can you explain what it means to you? And that's the best way to really approach that, in a way that's saying like, it's not that I don't understand that this is part of the LGBTQ identity spectrum somewhere. It's just, I don't know what that term specifically means in this moment. That's a really good way to do that.
Leah asks, as we're building the infrastructure for 988 over the next year or so, how would you recommend being responsive to gender/sexual minorities as part of developing appropriate crisis management services?
Two parts. One, specialized services, 100%. Trevor provides those. There are other providers of those types of services. We talk about this with veterans as well. There's a few other communities that could be a possibility for, but specialized services in order to redirect people to folks who have a higher understanding of those issues would be great. Second part, we need to educate all of our crisis services providers everywhere about base level LGBTQ identity issues. So making sure that they understand how to be respectful around pronouns and identities, making sure that they understand some of the common issues that our LGBTQ folks face. So two parts, specialized services and training for our current crisis services providers.
All right. And Scott says, thanks for a great presentation. You mentioned bullying as a factor for elevating youth LGBTQ risk. School administrators, staff, and teachers often seem reluctant to take proactive steps for bullying prevention, perhaps out of fear of opening Pandora's box. What does Trevor Project recommend for pushing bullying prevention efforts into schools?
We have to consider that bullying is actually part of a broader school climate issue. And so what you really need to do is build a school climate that doesn't have that bullying in it, right? Like that's the ultimate goal. So you have to look at how are students being supportive of one another? How are students addressing internal conflict amongst one another? All of those little pieces. Does your school have restorative justice as a method of dealing with issues in the classroom as opposed to punitive? And because how administrators respond to that is how the kids are going to respond to it. So it starts there, right? It starts at building that positive school climate. As far as addressing the current issues that exist, again, taking a restorative justice approach is definitely the method here. We want to be really careful in the fact that bullying is often being perpetrated by people who have other issues that are causing them to seek out that control in that environment, right? So why is the person perpetrating the bullying? What is the underlying issues there, and how do we address that? So always taking a restorative justice approach as opposed to the more punitive methods that we've introduced in schools previously.
All right, with a few more minutes left, we're going to try to get through these. I work at a primary practice. How can we show that we are LGBTQ supportive? Our staff talks to our patients, but is there anything else we can do in the practice, like put up imagery posters? Do you have any recommendations?
Yes. So your intake forms are the first thing that most people see when they walk in. You're handed a form, fill it out. Make sure that intake form has questions about a person's identity on it. Ask them their pronouns. Make sure that if you're asking for sex or gender, that you know which one you're asking for. Sex is biological, gender is societal construct. Both are important. In fact, you can ask both on the same form. It's a thing. That way you can get someone's medical information even if it doesn't align with their gender identity. So I oftentimes say ask both. Posters, signs, little rainbow flags, all of that is helpful. It's visual cueing for sure. Having people even having cisgender people wear their pronoun buttons, or having on their name tags their pronouns, is also a good signaling way, and normalizes utilizing pronouns that may or may not match someone's outside appearance. So all of those little subtle things are good cues to demonstrate that support, aside from, of course, then when you're working with that patient, making sure that you're respecting their identity in a variety of ways too.
All right. In spite of time, unfortunately, we did not get to all of the questions. However, Keygan, is there a way to get a hold of you or anybody at the Trevor Project that they can get some questions answered?
Absolutely. So you can send an email to myself at keygan.miller@thetrevorproject.org, or you can send to our general advocacy team at advocacy@thetrevorproject.org. Either way, you will get your questions attended to.
Thank you so much, Keygan. Really appreciate your time. For everybody that is still on, our next session starts right now with Sade Ali. She will be speaking on making suicide a never event, zero suicide in Indian country. So if you want to log off of this one and hop on to that next session, we are looking forward to it. Thanks again, Keygan.